Type 1 is really considered an autoimmune disease in which those insulin-producing cells called beta cells are destroyed by processes we're still trying to understand better. And in type 2 diabetes, people actually become resistant to their insulin. It doesn't work properly. And so over time, they certainly may also need to take insulin as a result. And then, of course, we have gestational diabetes, which happens during pregnancy. And that's almost like a preview. Women who have gestational diabetes are at high risk for developing type 2 later in life.
Everybody knows somebody who has diabetes.
There are 382 million people, estimated 382 million people with diabetes in the world.
If we don't change the environment that we're in and the approach that we take, it's going to be devastating. We're basically looking at 1 in 3 people within the United States having diabetes, in some ethnic groups, 50%. That's an unsustainable condition.
It has huge social implications on quality of life, but then when you build in the financing implications of that as well, which is that in certain segments of the population, while a pre-diabetic costs about $1,000 in healthcare spend, if you progress to type 2 diabetes, it's about $10,000.
It's hard managing my portion controls and being more conscious and aware of reading those labels, because now I have to consciously do it. I can't just eat anything that I pick up.
If I hadn't had gotten it, I would have been able to do like sleepovers. It has changed how I've met different friends. It's changed really how I eat and how I live. Basically, it's changed everything.
Diabetes has been dealt with as a medical problem for the last 100 years. We really need to start thinking about it as a public health problem.
It makes a huge difference even to postpone the onset of diabetes. We know that the most tragic thing now is these young children who in adolescence are developing type 2 diabetes. Type 2 diabetes used to be called adult onset diabetes because it was never seen in kids. And now all of a sudden, we're seeing this surge of type 2 diabetes in children. And what's really, really scary about that is that in these kids who develop diabetes earlier, it seems to progress much faster.
We really need to shift our paradigm to think about wellness versus just treatment.
Weight loss alone, if this was just about how do I lose 5% of weight, maybe that would be easy to think about. But this is a lifestyle change. This is not just how do I lose 5% in the next 10 days by starving myself or dehydrating myself. This is about making changes to daily routines, getting the support you need either from your family or a group of other people with prediabetes, and finding ways to incorporate healthier behaviors into your life and maintaining that 5% to 7% weight loss and regular physical activity.
A couple of months ago, we had a really major breakthrough where scientists were able to coax stem cells to become cells that can make insulin with the precise regulation in response to glucose that you need to have an effective beta cell. So now we can potentially make unlimited numbers of beta cells. Now we need to learn how to protect those beta cells so we can put them safely in the body and so that they could potentially deliver insulin.
The challenge is collaboration. How do you bring the right people to the table that would include those that know the research, that includes the communities that understand how this is applied, that includes the private sector that is thinking about this differently, that includes the finance folks. But how do you bring that together to have a conversation to actually solve for the problem?
I hope that we get a cure, like a lot of people hope.